Good evening, everyone. Thank you so much for joining us this evening as we discuss the patient confidence study put together by NATHEALTH, the Healthcare Federation of India, and IQVIA. I would like to extend a warm welcome to Mr. Amit Mookim, leader NATHEALTH Innovation Forum and the Managing Director of IQVIA South Asia, and Ms. Tina Khadloya, Senior Principal, PI, RWE, and CSMS at IQVIA South Asia. Thank you so much for joining us today. The outbreak of COVID-19 pandemic has led to major changes in patients' treatment plans due to the considerable restrictions in accessing healthcare facilities. We've seen this for over a year now. Patients had to delay their ongoing treatment and resort to best possible management measures at home under their treating physician's supervision. As the threat of the disease continues to be uncertain this year as well, it is important to understand patient readiness to return to their routine hospital visits and continue treatment. This will also support hospitals and the healthcare industry as a whole to navigate through the process of returning to stable operations and, of course, financial viability. To further understand and bring to the forefront patient sentiment, IQVIA conducted a survey with 2,134 patients, a large number, in January, February 2021, this year, with different treatment needs across metro, tier 1 and tier 2 towns in India. The objective was to gain an insight into the confidence levels of patients on the healthcare service industry. It was also meant as a checklist for all stakeholders in the healthcare sector to understand patient expectations and ensure satisfaction. IQVIA reached out to patients who had planned their surgeries, those who required IPD management, those who visited hospital OPDs in pre-COVID period, that is before March 2020, to track changes in patient behavior during COVID-19, a period from March to December 2020, and to elucidate the impact of COVID-19 on patients' treatment plan and how it could be restored. They were able to come up with some stunning statistics, one of which was that 57% of patients had cancelled or postponed their treatment plans on account of the ongoing pandemic. And this is a huge number. Also, that 95% of those who cancelled wish to continue the same with hospitals as face-to-face interactions. And why? This was surprising again, because face-to-face interactions boost their confidence levels and ensure stronger adherence to treatment. Teleconsultation witnessed an upsurge during COVID-19 period, even today, with 50% of the patients engaging in teleconsultation with their healthcare providers during lockdown. But while one saw a sharp rise in teleconsultation, face-to-face consultations still are the preferred mode of seeking medical help. The implications of these trends on patients is manifold, and today in this webinar, we will touch upon some of these trends and their overall implications on the healthcare sector, possibly be able to tell us what we thought was right and now realize is not so, and also to prepare us for the future ahead and how to actually provide care to those who need it. With this initial context, I now hand over the floor to Mr. Amit Mookim and Ms. Tina Khadloya to take this discussion ahead. Thank you all so much for joining and have a brilliant webinar.
Thank you so much, Dr. Mahajan, for setting context, for this kind introduction and setting the context. These snippets that you've provided, I'm sure, will generate a lot of interest amongst the audience. So hello, everybody. Today, I will be presenting insights of a patient survey conducted by IQVIA in collaboration with NATHEALTH to unearth the impact of COVID-19 on patients' behavior towards accessing healthcare facilities. Let us start by understanding the thought process that went in conceptualizing the survey design. The outbreak of COVID-19 pandemic has led to major changes and disruption in the way patients used to manage their health. Patients were very uncertain as to how and when they would be able to access healthcare facilities, especially during the immediate lockdown last year, to continue with their treatment and manage their condition. Hence, it was imperative to understand patients' concerns, especially their readiness to return back to hospitals and seek the right care and support. To this effect, IQVIA conducted a survey in Jan and February of 2021 across 2,000 patients, 2,000 plus patients, and different town classes. I would here, digress a little by saying that though this survey was conducted this year in Jan-Feb 2021, it captures responses for 2020 covering both during lockdown period as well as post-lockdown period. Hence, the findings and the insights and actionables are very relevant in today's scenario as well. The research had threefold objectives. First and most important was to unearth the patient behaviors during and post-lockdown, especially from the perspective of how did they manage their health. Second important thing was to understand how did lack of healthcare infrastructure access impact patients' health. And lastly, what is it that is required to restore patient confidence and bring them back to hospitals and seek the right care and support. What we did was we interviewed patients across three different categories. Category 1 patients were those with planned elective surgeries spread across cardiac surgery, cancer, general and orthopedic surgeries. In category 2, we covered patients which require inpatient or hospital treatment, such as those with acute ailments classified under dengue, malaria, urinary tract infections, etc., and chronic patients belonging to dialysis and chemotherapy ailments which require frequent hospital visits and care. The third category of patients involved those which required to consult hospitals, doctors in the hospital OPDs, covering ailments like cardiovascular, diabetes, arthritis, and asthma. In terms of the methodology, we adopted a quantitative research approach where the patients were required to fill a structured questionnaire on an online portal, and the length of the interview was 30 minutes. In all, we covered about 2,134 patients, very well spread across different hospital types, town classes, and by the three categories of patients that we saw on the earlier slide to get varied perspectives. Let's come directly into the key findings. And what we have done is the presentation flows into 5 broad parts, where we will start by understanding the anxiety levels and concerns that patients had to manage their health, especially during the lockdown period. We would then go on to understand what were the alternate behaviors that were seen, especially when it came to rescheduling, cancelling the surgeries and the impact of this on their health. When they decided to reschedule their treatment plans, when is it that they plan to return to hospital is the third important thing we'll cover today. What we will also understand is how do hospitals or what is critical for hospitals to do to restore this patient confidence and bring them back. And last and most important are some changing trends that we have seen emerge during this period and understand which of these are short-term and which of these are here to stay. Into the first key finding, where we start understanding about the patient's anxiety levels, and it was very clearly observed. Let me start by taking a pointer. Give me 1 second. Yes. So we very clearly observed that with the rise in COVID cases, anxiety levels amongst patients were also increasing. 77% of the patients were very, very anxious and concerned to seek medical care in 2020, and their anxiety levels came down only when COVID cases began to drop. And what were these anxieties about? Largely due to the risk of contracting infections on account of overcrowding at hospitals or exposure to infected medical staff. Because these people were very anxious and they did not access healthcare facilities, majority of the patients believed that their health conditions worsened in 2020. Let's look at some numbers that substantiate these findings. On this chart, what we have done is plotted the anxiety levels of these patients across various time points, starting with March-May 20 period, where we saw very high COVID cases, until January this year, where COVID cases began to slow down and almost normalize. What we see is very interesting, that the anxiety levels amongst the patients were very high during the March-May 20 period, and they have come down when COVID cases stabilized in the country. Also, amongst the different patient profiles, it is very interesting to note that the anxiety levels were highest amongst chronic IPD cases. Now, this is because these are dialysis and chemotherapy patients who cannot stop accessing hospital facilities for their treatment. So while they had to continue accessing, their anxiety levels were at the maximum, because they were always at a risk of contracting infections. If we look at the top concerns, these again revolve around the safety protocols and the risk at which patients are while visiting or accessing the healthcare facilities, owing to overcrowding of hospitals, exposure to medical staff who may have been exposed to the infection, increased exposure to these patients and worsening of their condition due to the hospital environment, immunocompromised patients because they have been suffering from certain ailments and hence at a higher risk, and lastly, lack of confidence or doubt whether the hospitals have been following the right protocols to minimize the risk. We also saw that the anxiety levels were very high in tier 2 cities as compared to metro and tier 1 towns. Now again, when we are seeing the second wave, we are seeing this infection spread to tier 1, tier 2 as well. So what this would translate in terms of findings are, whenever cases rise, there is a rise in anxiety levels. So probably the levels of anxiety are higher even amongst tier 2 population today. Also, very interestingly, patients were comparatively less worried when they were consulting or visiting large private and corporate hospitals, because they believed that these hospitals would follow the right protocols. Hence, in terms of implications, it is very important to create a platform where patients are easily able to report or communicate with their treating doctors or counselors, who are able to reinstill confidence and plan out a return for these patients in the near term. Moving on to the second key finding, where we're trying to understand behavior of these patients towards accessing healthcare facilities. And while we saw that the anxiety levels of these patients were very high during the lockdown period, 57% of these patients cancelled, postponed, or rescheduled their treatment plan in the last year. And majority of the patients who cancelled belonged to the group 1 or category 1 patients, which were elective surgery cases, and group 3, which were OPD cases. Now, the OPD patients, even if they did not cancel their treatment consultations completely, these were either done at reduced frequently or done remotely. Again, here we see very clearly that the most impacted were the chronic and acute inpatients, since they had very little choice and had to continue with their treatment. Also, very interesting point to note is majority of these decisions to either delay or cancel the treatments were taken by the patients and the caregivers in consultation with their treating physician. Let's substantiate these with some numbers. What I'm going to show you here is the different behavior or decisions, treatment decisions that patients made. Let's look at the surgery patients. Amongst these surgery patients, majority or all of them either cancelled or postponed their treatment or their surgeries. Amongst OPD patients, we see majority of them continued with the consultations but at very reduced frequency. However, for chronic IPD and acute IPD cases, like we said earlier, they had to continue with their therapy sessions. Amongst these IPD patients, at least when we talk about dialysis patients, they had some options of either not visiting the hospitals, so they visited standalone dialysis centers, or they at times opted for peritoneal dialysis at home whenever applicable. Among surgery patients, 60% of these patients rescheduled their surgeries from the March-May time point to August onwards, to the period August onwards. Amongst OPD cases, we see more number of cancellations or rescheduling happening amongst diabetes and arthritis patients. Also, like we saw in the previous slide, majority of the decisions to either cancel or postpone the treatment were taken by the patients and the caregivers along with the doctors. So here very clearly two implications that we see. One is for those set of patients who continued accessing the healthcare facilities, and it is very important for an hospital setup to provide them the confidence and that complete protocols are being followed, and they are risk free in terms of contracting infection while accessing hospital facilities. Talking about the second set of patients who cancelled their treatment plans, it's very important to keep engaging with these patients as well as providing alternate methods like home care facilities to manage their health. And why I'm saying this, let's see on the slide ahead. So very interestingly, when we spoke to these patients, that when they were managing their conditions at home and were not able to access healthcare facilities, what was their comfort level? And we see again, at least 50% of the patients found it extremely to moderately difficult to manage their conditions at home. Very evident among chronic IPD and acute IPD cases again. Also, when we spoke to them about the impact of the condition or disease, impact of not visiting healthcare facilities on the disease or condition, we saw all of them being majorly impacted. So even surgery patients said that their conditions worsened or deteriorated, and similarly the chronic IPD cases, where 69% of the patients have clearly stated that their conditions deteriorated significantly or worsened. Key modalities that were adopted for management of the conditions at home, it's very interesting to see that the surgery patients largely depended on medical management of their condition. Some adopted for home healthcare measures like physiotherapy, nursing support, etc. Amongst IPD cases, apart from medical management, home healthcare services like diagnostic support, IV infusions, and some reliance on medical devices were sought. Amongst OPD cases, it was largely teleconsultations that were adopted. So very interestingly, again, as a key finding, what we see here is patients who cancel their treatment plan. It is again, like we emphasized in the slide earlier, very important to support their conditions through some kind of home healthcare facilities, so that we do not find patients returning with worsened health conditions or deteriorated conditions. Moving on to the third tab, where we would now see that these patients who cancelled or rescheduled their treatment plan, when are they likely to come back? And we see that it really depends on the decrease in the COVID caseloads. So majority of the patients, we saw 82% of the patients quoting that they plan to return within 3 to 4 months of reported decrease or control in COVID caseload. And these are especially IPD cases, because they are dependent on hospitals and they would want to return back to their treating consulting physicians or treating hospitals at the earliest. And also amongst elective surgery, it was oncology and cardiac surgery patients who wished to reschedule their surgery sooner than the others. If we look at these time series that we have plotted right from March 21 to Jan 22 across these patients, we see again, if from a March time point where the COVID cases was very high, and we asked that if cases started decreasing, when is it that they're likely to return? They all said that, you know, May or June is the time point, which is 3 to 4 months from the cases subsiding is when they would come back to the hospitals and seek. IPD cases, we see that they want to return back sooner than the others. Again, we see that higher number of patients in Tier 1 and Tier 2 plan to reschedule their treatment sooner than those in metros. Now, again, very interestingly here, we have to note that that hospitals would need to take in a lot of efforts to reduce the lag time between the decrease in COVID cases and the patient's comfort in returning back. This could happen by communicating with the patients, engaging with them, and convincing them that the hospital environment is safe for their return. Let's now move on to the roles that hospitals would need to play to restore this patient confidence, and we have some very interesting findings for you. So when we asked these patients on their confidence in returning back to the hospitals or the doctors for treatment, whom would they depend on for making these decisions? And patients have very clearly stated that they have high trust on their treating physicians to make the informed decision on return. Let's look at this chart here. If you look at the 10-point scale that was administered to these patients on their level of confidence, and what we have plotted here is the top 2 box scores, we see higher confidence on the doctors than on the hospitals, which will enable these patients to make a return decision. Also, top factors that increase patient confidence revolve around the safe environment that the hospital is able to provide, as well as minimizing the risk of catching the COVID infection, which can be done through these 5 pointers. First of all, hospitals would need to prioritize and segment patients into those really requiring to visit the hospitals in person and those who could manage with teleconsultations. Displaying hospital preparedness towards strict control, and this would happen only through communication. No waiting periods at all, a proper appointment system to be managed, preventing overcrowding and following the protocol of social distancing. And lastly, hospitals with both COVID and non-COVID patients would need to have very clear and separated sites. What we see very clearly is the confidence of on the healthcare systems was higher amongst metro city patients, and again high for those visiting large private and corporate hospitals as compared to the others. Let's now delve into some changing trends that have been observed during this period. So we spoke to these 95% of these patients who cancelled or postponed, of all the patients who cancelled and postponed their treatment. Very interestingly, 95% of these patients wish to continue with the same hospital. And this is because of the trust, belief, and high level of satisfaction that they have in with the same hospital or their treating doctors. The adequate or extended support services that were meted out during the lockdown period or the time when the patient was not able to access the facilities, and high confidence that their hospitals have taken the right protocol and measures to keep the environment safe. The 5% patients who switched the hospital were largely because of the increased cost of treatment in the original hospital, travel inconvenience, or larger waiting periods, especially in cases of surgery. Very interesting trends across metro and tier 1 cities. So if we look at the metro city patients, these people would want and would always go back to their original hospitals of treatment. Amongst tier 1 and tier 2, we saw that there were 5% patients who came to metros to seek treatment. Now, in 2020, few of them underwent surgery, especially at their own cities or towns. But as soon as things or travel restrictions were over, they would want to come for future consultations to the original hospitals in the metro. Those who planned or postponed their surgeries to 2021 would plan and come back to their original hospitals for accessing facilities and treatment. So let's go and check another new trend that we saw around teleconsultations. We saw teleconsultations rose rapidly during the lockdown phase. Almost 50% of the patients adopted to virtual consultations in the March-May period, but very interesting to note that the levels dropped to 11% in Jan. And all of these patients wanted to do inpatient consultations, especially when the COVID cases started decreasing. Teleconsultations largely witnessed an upsurge among surgery and OPD cases. What is again very interesting to note is of all the patients who availed teleconsultation services either during the key lockdown phase or later, only 30% of these patients are willing to continue with teleconsultations in future. And that too largely for follow-ups. For any kind of new consultations or severity in symptoms, they would want to visit back hospitals or clinic setups. It is also very interesting to note that of the 57% patients who cancelled or postponed their treatment, only 2% of these patients opted for home healthcare services. And we saw this adoption largely amongst the IPD or inpatients as well as patients in metro cities. The services they availed can be grouped into diagnostic support, personal support, treatment support at home, or doctor visits at home. Again, not too many patients, it's just 33% of the patients who would want to continue with the home healthcare services. With that, I would hand over to Amit to take us through key implications and clear action points for the industry. Over to you, Amit.
Thank you, Tina. And thank you for so lucidly explaining such a complex survey that was carried out in such a short time. Before I go to the implications, I also, on behalf of both IQVIA and NATHEALTH, want to thank all of the hospitals and providers who supported this survey. So really grateful for that. Otherwise, it would not have been possible without their support. I think the other area which Tina pointed out, and as we move into this current year, we are also cognizant that this is the second wave that we are witnessing. But the important part is to understand what elements of patient behavior of last year will carry on into this. And I think that is what Tina was trying to say, that some of the confidence issues that patients had with respect to hospital access, facilities, fear of infection would only get compounded during this point of time. I think if we look at the implications from two parts, one is during the onset and the active case implications that are happening in the country, there are two things that come out, right? One is that chronic patients who especially seek IPD services or face-to-face OPD consultations need to be given special attention. And we may look at specialized OPD infrastructure and patient-friendly teleconsultation platforms that need to be put in place. And this comment is specifically coming from the fact that we saw a drop in propensity of patients to continue teleconsult as the pandemic receded. So that is one aspect, because there is more anxiety in chronic patients about their own immunity. I think the other aspect which we saw, which was also a surprise to us, that home healthcare services were opted by a limited number of patients. And I think it's incredibly important that this particular service is integrated well with the hospital network so that there is seamless flow of patient care throughout the journey. And it's even more important during COVID cases because there is more anxiety and more strain on the hospital infrastructure to actually deal with non-COVID patients. And then when we look at the other aspect, right, which is once the pandemic gets more in control or the peak passes, which is what happened in the later part of last year, and will likely happen this year as well in a point in time very soon, hopefully. There are three things that come out, right? One is that it is for sure that there is an inherent level of trust that patients have in their current providers, which was seen by the 95% of people wanting to come back to the same. But the issue is going to be the huge backlog that some of these patients are going to face. And I think it's very important for providers to actually some metrics or pathways or rules to make sure that the right patients are prioritized for treatments first. I think the second piece is that the anxiety level has moved beyond the pandemic, and there's also now an additional anxiety that their health situation has been further compromised, where 62% of patients who delayed their treatment felt that. And I think the one manifestation of that fear people have is that it'll lead to increased spend and outlay in hospital bills. And I think this is a matter of more transparent communication that the hospitals will need to have with the patients and educate them on the cost of care as applicable in their current case. And the last piece is that patients will continue to access the original doctors and hospitals. And I think it's a pivotal moment. And I can't re-emphasize this more, that it's a pivotal moment for hospitals to continue to sustain and build that patient confidence. I think what clearly came out is that there is very strong confidence of patients in their providers. Where they were anxious and they lost confidence is the fear around contracting COVID while moving around the facilities. And I think some of that communication of strong infection control practices and other specialized and segregated infrastructure will go a long way in building that confidence to access and come back for full-time care with these doctors and hospitals. I think with this, we would like to thank the NATHEALTH team for supporting this survey. We wish that this information would be useful for the network of NATHEALTH to plan some of the initiatives for this year. This year is a very important year with respect to managing the pandemic as well as continuing to build the patient confidence. And again, wishing you all a very good evening, stay safe, and thank you to everyone.